Μεταδώστε την είδηση, όχι τον ιό. Spread the news, not the virus. Το Solidarity Now, η ύπατη αρμοστία του ΟΗΕ για τους πρόσφυγες και το pod.gr ενώνουν τις δυνάμεις τους σε podcast για να σε βοηθήσουν. Άκου πώς μπορείς να προστατευτείς από τον πανικό των fake news στα αγγλικά.
Spread the news, not the virus. Solidarity Now, the United Nations High Commissioner for Refugees, and pod.gr join their forces to support you through a series of podcasts. Listen to how you can protect yourself from the panic of fake news in English. Spread the news, not the virus. In the fight to reduce the transmission of the new coronavirus, we are all one team. We stay informed, we take precautions, we stay safe, and we protect those around us. Coronavirus, misguidance, and panic. Say no to fake news. In this episode, we address the rumors and fake news on the new coronavirus, also known as COVID-19, and share the World Health Organization guidance on the facts regarding coronavirus. In this episode, when we refer to the coronavirus, we are referring to the new COVID-19 virus. The WHO advises people of all ages to take steps to protect themselves from the virus by following social distancing, good hand hygiene, and good respiratory hygiene. Anyone can fall sick with the coronavirus. People of all ages, nationalities, races, and social classes can be infected by the coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more affected by the virus. People of all ages who experience fever, cough, and difficulty breathing should seek medical attention. A person infected with coronavirus does not always have symptoms. Not everyone with coronavirus will have symptoms. Some people may be infected with coronavirus and have no symptoms at all, or only mild symptoms. Even people with very mild symptoms of coronavirus can transmit the virus. Common symptoms of coronavirus are fever, dry cough, and tiredness. Some individuals may have aches and pains, nasal congestion, sore throat, diarrhea, trembling, and sudden loss of or decrease in taste or smell. These symptoms are usually mild and begin gradually. Most people, about 80%, recover from the disease without needing hospital treatment. Around 1 out of every 5 people who get coronavirus becomes seriously ill and have difficulty in breathing. Coronavirus is transmitted in both warm and cold weather. From the evidence so far, the coronavirus can be transmitted in all areas of the world, in both areas with hot and humid weather and cold weather. Regardless of climate, it is important to protect yourself and others against coronavirus by following health guidance. Coronavirus cannot be transmitted through mosquito bites. To date, there is no evidence that the coronavirus can be transmitted by mosquitoes. Coronavirus is a respiratory virus which spreads primarily through droplets when an infected person coughs, sneezes, or speaks. These droplets can come from the mouth and nose, can land on objects and surfaces near the person such as tables, doorknobs, and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. To prevent infection, it is important to frequently wash your hands with soap and water or clean your hands with alcohol-based hand rub. Drinking alcohol does not offer protection against coronavirus infections. Alcohol consumption does not protect against the coronavirus but can make your body vulnerable to infection. Drinking alcohol weakens the immune system and reduces your resistance to possible infection. While alcoholic antiseptics can kill the virus on surfaces, consumption of alcoholic beverages does not kill the virus in your body. Consuming alcohol into the digestive system does not prevent the virus from entering and spreading through the respiratory system. Ingestion of antiseptic alcohol is very dangerous and can cause poisoning. Spraying alcohol or chlorine all over your skin does not kill the coronavirus. Spraying alcohol or chlorine all over your skin do not kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes like eyes and mouth. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. To avoid infection by the virus, frequently clean your hands and avoid touching your eyes, mouth, and nose. Coronavirus is not transmitted through food. There are no indications of transmission of the coronavirus through food. Due to the poor survival of the virus on surfaces, transmission through food or packages that have been handled in the past days or weeks in room temperature or under deep freeze conditions is considered unlikely. However, a person can be infected with the disease by touching surfaces contaminated by the coronavirus and then touching their own mouth, nose, or eyes, although this is not the primary way of transmission. Washing fruits and vegetables with a disinfectant is dangerous. The use of disinfectant for washing fruits, vegetables, or other foods is not a safe practice, as it may cause poisoning or other hazards. The safe preparation of each meal is important, not just during the pandemic, but also in general, for protection against germs and viruses. To safely prepare food, wash your hands thoroughly with soap and water for at least 20 seconds before preparing your meal. Wash fruits and vegetables with plenty of running water before you cut and clean them, and dry them with a clean paper towel. Wash properly any knife or fork that has been used for processing raw meat, seafood, poultry, eggs, etc. before using them to eat. Wash kitchen surfaces and utensils with warm soapy water after each use. Eating garlic does not offer protection against coronavirus infection. Garlic may have some antimicrobial properties, however, there is no indication that garlic consumption can protect you against the coronavirus. The coronavirus epidemic is not related to specific technologies. Theories have been reproduced mainly on social media that link the pandemic of coronavirus with the development of fifth-generation mobile telephony networks, 5G. The World Health Organization has stated that no adverse health effects are causally linked to exposure to wireless technologies such as 5G technology. Current medicines can treat the symptoms but not the coronavirus. To date, there is no specific medicine recommended to prevent or treat the coronavirus. According to the WHO, while a vaccine for general use takes time to develop, a vaccine may ultimately be instrumental in controlling this worldwide pandemic. Until a vaccine is developed, preventive measures such as social distancing and frequent hand wash need to continue to prevent the spread of the virus. Those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimal care. Some specific treatments are under investigation and testing through clinical trials. Vaccines against pneumonia do not protect you against the coronavirus. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B, vaccine do not provide protection against the new coronavirus. Although these vaccines are not effective, vaccination against respiratory illnesses is highly recommended in general to protect your health. The COVID-19 virus is so new and different that it needs its own vaccine. Antibiotics do not prevent or treat coronavirus. Antibiotics do not work against viruses, only bacteria. Coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the coronavirus, you may receive antibiotics because bacterial co-infection is possible. We need to pay close attention to social media posts and check facts by consulting the guidelines of the World Health Organization, WHO.int, and the National Public Health Organization, AOD.gr. These bodies are the most reliable source for accurate and scientifically substantiated information on updates and guidelines related to the coronavirus. We do not panic. We do not let fake news panic and mislead us. We take care of ourselves as much as we can, always based on the official guidelines and not on rumors. We will not let fear win. Stay safe.
Ήταν το Frequently Asked Questions for Migrants, ένα podcast του Solidarity Now σε συνεργασία με την ύπατη αρμοστία του ΟΗΕ και το pod.gr, που δίνει χρήσιμες πληροφορίες σε πρόσφυγες και μετανάστες που ζουν στη χώρα μας. Βρείτε το podcast στην ιστοσελίδα του Solidarity Now, στο pod.gr, στην ιστοσελίδα της ύπατης αρμοστίας help.unhcr.org, Spotify, Apple Podcasts ή όπου ακούς podcast από το κινητό σου.
It was the Frequently Asked Questions for Migrants, a podcast by Solidarity Now in collaboration with the UNHCR and pod.gr that gives useful information to refugees and migrants living in Greece. Find the podcast on the Solidarity Now website on pod.gr, on the UNHCR website at help.unhcr.org, on Spotify, Apple Podcasts, or wherever you listen to podcasts from your mobile phone.